All right, gotta do them number 10. If you find that you're having a difficult time keeping your weight off over the long haul, get personal counseling. It's also a good idea to do this during that first year while you're losing weight. Again, people who go through treatment for other addictions have what they refer to as an aftercare program. They go to therapy once a week with other people, and they learn to live life on life's terms. It's not that easy to go from using food as your friend to not having it there. And you need sometimes to find out what's underneath this. Maybe, you're familiar with your body being overweight. And as you lose weight, you become very, your feathers get ruffled. You don't know how to deal with yourself in a thin body. Believe it or not, sometimes people actually gain weight back because they feel more comfortable in a heavier body. It's one of those things where people say, why does somebody stay with an abusive partner? Well, unfortunately, sometimes that's more familiar to them than being on their own. And sometimes being in a heavy body is more familiar to a person who maybe say you've always been heavy. So professional counseling is a wonderful thing to do. I see a lot of people maybe just once a month or once every 2 months just to kind of, help them grieve the loss of food. Let me say a word about depression while I'm on it. Some people, after they have bariatric surgery, will experience something like a postpartum depression. There are a couple of reasons for this. One, remember, food has been your companion for a long time. And when you don't have food to turn to, sometimes you're going to grieve it. I've actually worked with people where they have literally written letters to Oreo cookies to say goodbye to them, and I don't know how I'm going to live without you. But it's important that you recognize the fact that food is going to be, you're going to be grieving food. It's going to be lost to you in an emotional sense. That's not silly. That's important. Okay, so remember to get counseling if you need it. It's a good thing. I think everybody needs counseling. Remember, there's no shame in having problems. It's just shame in not getting help for them. So get whatever help you need. It's a good thing to do. So the 10 gotta do-ems, they're the way to keep your weight off and stay healthy. The goal is to have lifelong health. I've made you a sheet with the 10 gotta do-ems, and I've even made it Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. And you can check them off. Make yourself copies of that. I'll give them to you when we meet face to face. And in summary, I just want to say, this surgery is necessary. For people who think you're taking the easy way out or think you can do it on your own, remember, they're not in your shoes. They don't know what it's like for you. Research has clearly indicated that only 1 person in 100 who's obese can lose the weight and keep it off. So this surgery is necessary, but the surgery is only the beginning. The surgery will help you keep it off. The surgery will help you get it off. The surgery alone will not help you keep it off. You need to do that. You need to accept responsibility. You need to have other people help you. You're making changes that are lifelong. One thing that a patient said to me recently that I absolutely love, she said, I'm not fat by choice. I'm fat because of bad choices. And it's true. So in order to remain at a healthy weight for the rest of your life, it's going to be by making healthy choices for the rest of your life. Acceptance and adherence and gotta do-ems. That's your key to success. I look forward to meeting with you. Write down any questions you have and we'll go over them at the time of your interview. Thanks for listening.